Hi, I'm Diana Alexander, and I'm here again to bring you another San Bernardino County COVID-19 news update. Today you will notice I do not have on a mask, and that's because we're taking advantage of technology, and we're actually going to be filming in two different locations. Our featured guest today is in the field, and so since we're not next to each other, we don't have to wear the mask. I know that many of you have been asking questions about different things that you've heard relative to COVID-19. One of those things is, what exactly do they mean when they say flatten the curve? Well, today we have a very special expert. His name is Dr. Troy Pennington. He is a doctor in the emergency room right at the front line at our own Arrowhead Regional Medical Center. And he is going to give us a definition of exactly what flattening the curve means.
Hi, my name is Troy Pennington. I'm an emergency room physician here at Arrowhead Regional Medical Center, and I also have the honor to serve as the medical director for the San Bernardino County Fire Department. I wanted to talk to you a little bit today about the importance of flattening the curve. I know many of you may have heard this term a million times in the past couple of weeks, but what you are doing is so very important. Flattening the curve refers to us being able to decrease the transmission of this virus in the community. One of the things you might notice about me right now is the fact that I'm wearing this facial mask. As of last week, on the 7th, the San Bernardino County Public Health Officer requires all individuals when they're out in the community to wear a face mask. This is so that we can decrease the transmission of the virus from person to person. So if we don't wear the face mask, essentially what's going to happen is we have more communication, small little droplets spread from person to person. We're going to increase the number of cases of the virus within the community. Currently in the community, when we look at our doubling time, when you hear someone say doubling time, that means if we have 100 people in the community that are infected today, how long does it take before we have 200 people infected? The doubling time right now, according to our best estimates, is about 5.2 days. So in about 5.2 days, if we have 100 people infected today, there's going to be 200 people infected at the end of that 5.2 days. We're able to slow down that doubling time right now by doing something like this. Make sure that you're wearing your face mask. Make sure that you're doing good hand washing. These things are all crucial to decreasing community spread. You might ask, how do we know that you're doing a good job in the community flattening the curve? One of the things that we're able to look at is we're able to look at how much movement there are of cell phones in our community. And we know that since February 4th, we've decreased non-essential movement by about 55 to 60%. So I know you guys are sheltering in place, you're staying at home, we're doing what we're asking of you. So we need to keep it up. These are so very important to decreasing the rate of transmission in the community. Although you may be younger, you may decrease the risk of transmission to your older parents or perhaps your grandparents. And we know that there are special communities that are at dramatically increased risk. Those individuals that are immunocompromised or have chronic medical conditions, and especially the elderly that are over age 65. So that's all for today. I want you to be smart, be safe, be good to each other, and we'll see you next time.
Thank you so much, Dr. Pennington, for sharing your knowledge and your expertise with us. I'm sure our county residents feel a whole lot more informed than they did before they got to hear you talking about this particular topic of flattening the curve. Again, we just want to remind you that this is San Bernardino County COVID-19 News Update. I'm Diana Alexander, and please take care and be safe.